Hello, it's Dawn, your natural hormone balancing specialist, and October is Breast Cancer Awareness Month. And when I hear that, I think that's great, but we're all aware that there's breast cancer. So continuing to raise awareness is great, but I think we need to get into a little bit more of an understanding and what we can do about it. Because at this point, I think we've had enough, and I want women to look and feel their best and not have to deal with this dread disease. So let's get into it a little bit. Being that my background is naturally working with balancing the body and balancing hormones, I discovered two things. That hormone driven cancers are obviously related to hormones, right? That's in the name, right? But there's another factor as well, and that's, well, two factors: toxins in the body and blood sugar being off. So I did an experiment, and it was a study, and it actually got published in the original Internist, which went to about 8,000 doctors. It was with a large university. And we took the saliva, the hormone profiles of women that had breast cancer, estrogen receptor positive. That's what I'm mainly going to focus on because that's the most popular type or the most common type of breast cancer. 25 women with, 25 women without, looked at their hormones and said, what are the women with breast cancer? What's going on with them hormonally? Since it is a hormonally driven cancer, what do they have in common or different than the women that don't? So that kind of would just make sense to do that. I kind of wonder why the medical community hasn't done that so far. So anyway, what we found is women with breast cancer, and I kind of knew this, are very low in progesterone. But guess what? So is the average woman. The average woman is low in progesterone, and we'll talk about that in a minute. But the women with breast cancer were very low. They had like sub levels of it. But what's interesting is that their estrogen started to come down too. Okay, there's still a gap. The gap is the problem. So they have really low progesterone and their estrogen starting to come down. The average woman who's got PMS, menopausal symptoms, gaining weight, hormonal imbalances, has lower estrogen, still estrogen dominant, but it's not as big of a gap. So it's the gap. So here's what's going on. Estrogen receptor positive is a great way to describe it because estrogen is stimulatory, right? It makes you pop an egg for ovulation, great. Makes your breasts grow. It does stimulatory types of things in the body, gives libido. So that's good. But when it's out of balance, it also causes weight gain. You're hungry, you have anxiety, you have depression that goes along with it. You can't sleep, and you start to build things that shouldn't be built. Fibroids, or heavy linings and get a heavy period, endometriosis, or God forbid, breast cancer. So estrogen is a key role in that. But the key is we can't say it's high estrogen that's causing the cancer because women that are young have higher estrogen than older women or breast cancer people, women that have breast cancer. So that can't be said. Pregnant women also have high estrogen. They don't really have cancer. So what's going on? So it's not so much the estrogen, which I just told you is going down in a woman. It's the gap. So what's going on with progesterone? Progesterone is a protective effect. Okay, so progesterone is also a woman's best friend because it's a fat burner, it's a diuretic, it helps stabilize your mood, anxiety goes away, you sleep better, and then you don't have this building up of excess tissue or heavy periods, which you don't want anyway. So the balance of the two is what we need. So I wanted to bring that to the forefront because instead of always saying, okay, a woman has breast cancer, let's put her on tamoxifen. Obviously, if there needs to be a removal, I understand that. But let's put her on a drug that maybe will push down estrogen or look at that way. Why don't we look at bringing up progesterone? And that I think is key. Progesterone has a protective effect against breast cancer. And there's plenty of studies around. I just did my individual one. There's tons of information, a lot of it coming from Europe, that says progesterone is stabilizing and has a protective effect, especially with ER positive breast cancer. So I wanted to bring that out. We're going to do a couple more videos that talk about some tips. But for now, Dawn, coming from BeBalanced, where we take the guesswork out of women's weight loss and wellness. And breast cancer is certainly a big part of that.